2021 has been, let's be honest, a really interesting year. So we're going to recap what's been happening over the past year in terms of our GP awards and go over our predictions that we made last year, which were spookily accurate, and tell you what we think is going to happen in the year to come as we tech enhance your primary care and learning. Hey GP learners, welcome to this episode. We're going to recap basically 2021 for you in terms of what's been happening with technology enhanced general practice, as well as giving out some awards to some interesting people and reviewing our predictions, Andy.
Yeah, so this has become a bit of an annual tradition. We've done this in 2019, 2020,
Yep.
2020, 2021. In fact, that's where we are now. So yeah,
Exactly.
So third year of doing these awards and predictions episodes.
Yep, and just for declarations and stuff, both Andy and I have tested our LFTs and we're wearing masks to try and prevent the spread of Omicron, which is kind of rife at the moment. So just to give you that reassurance. And obviously we've got some mentions with some of the companies that we're going to talk about because we've done some work with quite a few of them. So declaration there for you all and stuff and things. But it's definitely been interesting. We wanted to recap our predictions from last year. So if you haven't checked that episode, it will be down in the links below. But we did predict a couple of things in particular, Andy.
Yeah, so let's review some of our previous predictions. And I think we should go back to the predictions we made in 2019 for 2020, perhaps.
Okay.
So let's just build this up. So in 2019, going into predictions for 2020, I predicted the bursting of the primary care network bubble.
Mm-hmm.
I don't think that's happened yet.
No, it's kind of been a bit rocky at times, I think. But yeah, it didn't quite burst as such. Compared to mine, which was the rise of remote consultations, which I guess in a sense due to COVID kind of literally exploded shortly afterwards, didn't it? So
yeah, that was eerily accurate.
Yeah,
that was really,
I think that was almost Simpson level prediction accurate in terms of how good they are at predicting the future and stuff. But hey, that was 2019. Last year though?
Yeah, so I predicted shortages. Don't know quite what inspired me there, but we've certainly had a lot of shortages of all sorts of things. Shortages of workforce, people, the labour market in general, lorry drivers, all sorts, HRT products, other medications. There's been lots of shortages. So I think I was pretty on it with that, really.
Yep, definitely less pessimistic than mine, which was the end of primary care, which I don't know. Do you think it's been the end of primary care this year? Love it if you could tell us, and if you do so, let us know in the comments. But yeah, I don't think we quite got to the end of it, although I guess it depends on your perspective.
I don't think so. I mean, I saw some patients this morning, so we're still rolling. Taken a few more knocks, I think, over the course of 2021. But we're still rolling. Maybe that, we'll review predictions for 2022. Maybe that's going to be your prediction again. Keep saying anything for long enough and eventually you'll be right.
Yeah. But before we get to that, we're going to get to our lovely awards. And as you can see, we have two of them right here for you. So just going to lift those up. And if you get rid of the banner.
The banner? Oh, of course, yes, because we're moving to the awards.
Disruptor Award for our Golden Pineapple, which is our Disruptor Award. In the past, this has gone to COVID and NHS England, I believe.
I believe so.
Yeah. And we've got the Most Innovative Tankard Award. And in the past, that's gone to people like Accurix, Primary Care IT. I can't remember the other winners in the past.
I can't remember, but there's an illustrious history to this award. Many great companies have won it in the past. And of course, we're talking about top tech as well, which is the top award, the top accolade at EGP Learning. But shall we begin with the most disruptive?
So, Andy, where do you think we've been with that?
I'm going to give the award, drum roll. I think we had drum roll and applause last year.
We did.
A bit bare bones this year. I'm going to give that award to, to NHS England itself. And I'm coming at this from the angle of what has disrupted my life and the life of my colleagues most over the last year. And NHS England has been keeping us on our toes. They've been asking us to do all sorts of things at very short notice and sort of moving goalposts throughout the year. I think, having said NHS England, part of me is now thinking COVID again, because I think NHS England have been quite responsive to COVID. So I think that we need to give an honourable mention to the COVID-19 virus, which is still here and continuing to mutate and disrupt as we speak, with the Omicron variant, cases rising throughout the country. But yeah, NHS England, really been keeping us on our TOES, Winter Access Fund, different vaccination drives and enhanced services, letters at very short notice, asking varying contracts at very short notice. Yes, lots going on.
Fair enough, Andy. So I definitely agree that they are top contenders. They're not my most disruptive, though. For me, I think, and I think many people in general practice might agree with me on this one, it's the media. Because I think actually they've controlled most of the other actions of those companies. So, for example, like NHS England, I've never hidden the fact that I think the media is actually controlling the response of our Secretary of State for Health, as well as NHS England's actions and stuff. And yes, I'm sure some people think I'm being very sceptical or whatever and stuff, but
I think I'm actually going to make a real tinfoil hat for next year, because I often talk about the metaphorical tinfoil hat, because we do sometimes behave in a bit of a paranoid fashion, I think, sort of towards the media, or at least feel persecuted by them. But you know, you're only paranoid if you're wrong, aren't you? And maybe they are out to get us.
Yeah, so we don't have an overall winner for the Golden Disruptive Pineapple Award. So we're going to telecommunicate that over to both those organisations rather than actually send it to them. But there you go, media and NHS England Golden Pineapple Disruptive Award. It's yours.
So next, the most innovative award. So there's a little story behind the company that I've put up for the most innovative company here, and it sort of begins last year because we had a lot of new and young companies coming along last year, being very, very innovative. So the likes of AccuRx, for example, and other companies who were developing new ways for us to consult, new ways for us to easily do video consultations, communicate with people via text messages, receive images back from people. And they were really, really innovative. And I think we were wondering, I think they caught some of the bigger IT companies, providers of electronic record systems, for example, on the hop last year. And I felt that those companies were probably too big to respond
possibly
to that challenge, and that they were perhaps threatened in some way, or at least that innovative space was to be ceded to these new companies, and maybe they'd start to buy some of them and bring them on board. We have seen some collaborations, but what we have seen is a lot of those incumbent companies actually developing in-house some of the technologies that the disruptors have brought to the table. So my nomination, or my award for the most innovative company, goes to System One. Now, perhaps EMIS could be up there, and some of the other electronic record providers, but System One is what I'm most familiar with. And they've done a lot of innovation over the last year. I'm just thinking about the community and things that we're actually using and integrating into practice, into practice every day. Things like the communication annex, the ability to communicate by text message with patients in a more innovative way, get images back and into the record. There's the appointment booking links, where you can send a specific link to patients and they can book specific types of appointments. You can send patients links to surveys now and get that data sent back and recoded into their records. They're bringing out Bridget soon, so that we can use our iPads and iPhones to consult in patients' own home. EMIS have had a similar app around for a long time. I'm aware, but they're catching up with that. And the Admin app is actually becoming more and more useful, and I think a true competitor to, if not the NHS app, then a lot of the newer services for managing same-day demand, etc. So I think System One have really, really stepped up this year. Declaration of interest. We have worked with System One over the year. We had a conference with them, but I think they've been really disruptive, and I think it's interesting to see the empire striking back against the young upstarts.
Yeah, there may be some Star Wars themed references in this episode, so just to pre-warn you on that. I think there's definitely been some interesting companies coming up. So obviously AccuRx from a couple of years has always been a regular feature of this awards, and absolutely is a contender from my perspective. And they've brought out some cool stuff this past year.
Definitely.
Record View, which I was quite cynical about. I didn't really see the benefit of it, but actually starting to see some of the benefits of that particular feature. We've had people like Eva Healthcare really push the boundaries in trying to help practices with doing their vaccination delivery, and trying to come up with as the alternative Pinnacle, which I know for many practices they found that really effective. And I guess another one that really comes to mind for me is Exxon, that have just done some amazing stuff in terms of innovation across general practice and trying to support practices with some of the features they've got. But my winner for innovation is also going to be TPP System 1. And it wasn't originally. It wasn't until me and Andy started talking about it.
Did I convince you?
He did. So Andy did convince me in some ways. And yeah, on reflection, they have done some really amazing things that have actually been a noticeable impact in the quality of GP's functionality and workload and stuff. So the communication annex was just an absolute godsend in terms of workflow for many clinicians. The appointment link booking, I know so many places are just literally, it's just revolutionized the way that they work. I think the introduction of the questionnaires into that workflow as well is going to be amazing. When Bridget comes out, I think it's just going to be a really cool piece of tech. And hats off to System 1. Again, Andy's point about our declaration, we do work with System 1 on certain things, including our conference, which was absolutely amazing this year and definitely coming back next year. So definitely keep your eyes out for that. But it did just eke out the others for me, and that's probably because we use it so much. Yeah. So yeah, you mentioned EMIS. I'm aware, speaking to a lot of EMIS users, they're not happy with it. So
that's why I don't use it. So I'm not sure.
Yeah, well, we're not going to make too much of a comment, but I think that's so. Yeah, we have the Tankard Award.
There you go.
So we're actually going to have to try and figure out how we can get that to System 1 in some way, because we've both done it to the same person, which I don't think we've ever done that before.
No.
That'd be interesting. Maybe we can give it to them when we go for the conference. If that happens face to face. If that
happens and we get to use their headquarters, that'd be really, really exciting. So watch the space for that. I just think it's going to be really, I think in a way they've started to eat the lunch of some of the smaller providers now by mirroring a lot of their functionality and including it within just the overall general cost of System 1 without any additional costs, which I think is really, really interesting. I'm going to be interested to see what that does to the ecosystem and what it does to the smaller providers. And I think it'll probably just drive more innovation from those smaller providers who continue to push the envelope. And then some of the bigger providers, adopt what works. And maybe that's the sign of a really healthy, product ecosystem working, delivering what people need.
Fingers crossed. But now we're going to go to the big award, which is the Top Tech Award. Now, we've done this in different ways in the past. We've counted down that kind of stuff. We're going to keep it a bit snappier this time. We've definitely got some honourable mentions, of which a few of them we've already covered. So people like Eva Healthcare, as I mentioned, Exxon, Arden's absolutely doing some amazing stuff and things out there. But we kind of debated about who wins the Top Tech Award from our perspective. Andy, do you want to go for yours?
So mine, I'm going to put N365 up there for top tech award, and it was between sort of System 1 and N365, and this follows my theme of the Empire Strikes Back. The big companies coming in with well integrated, well thought out, well designed, packaged together solutions for people to use and be really productive. So N365 is the NHS contract or license for Office 365, which is provided by Microsoft, huge company, and incorporates those products like Teams, Microsoft Office, OneDrive for file storage, Outlook for emails, and just thinking about how awful IT was in the NHS only a few years ago. We used to complain about Internet Explorer 8 or whatever we were still using 3 years ago. It's just been that partnership with Microsoft has completely transformed how I work every day. There's probably not a day that I'm not in a Teams meeting. We use Teams chat. We're sharing documents within the Teams environment or OneDrive live, editing them together. In terms of running a distributed organization like a primary care network across multiple sites with a lot of the staff working from home, all of those functions of NHS Teams or NHS 365, from the email to the chat to video calls to file sharing, all just really help us be more productive. So it's been really, really useful. So that's what I'm putting out there, Gandhi. Try and beat that or agree with it.
Okay. So I'm not going to agree with it, but I am going to point out that I agree N365 has been an amazing boon to general practice. And absolutely, if you want tips on how to use it, definitely check out our conference course recordings that we have with Redmore Health, that basically shows you how you can really maximize the use of Teams and N365 for your practice, for your network, for your CCG, basically whichever part you're working in. And there's so much content. And again, we'll put the link for that down below and stuff. But for me, so I think that System 1 was close again, and I must admit that. But I think some of the innovation I've seen from one particular company in the past year and the way they've developed that consistently over the past year in terms of trying to help practices has really shone out for me. And that's Primary Care IT. So again, another little declaration, I do have an honorary contract with them. It's unpaid. I don't get any money from them at all. But it's more for protection for some of the videos I've done for things and stuff. But effectively, I think they've produced some really cool stuff year on, year out. But in the past year in particular, they've really churned out some extra things. So particularly like their PCN trackers in terms of the kind of optimization workflow kind of searches and stuff. Ardens are with them there, and the only reason I haven't given it to Ardens is simply the fact that I think Primary Care IT have come from a further place behind to come forward. I think Ardens were doing a lot of that stuff already, and it's one or the other. For I think for some people, both in some cases. But I think just because Primary Care have just come from further behind ahead, I think that's the reason why I'm giving it to them, to be honest.
What's been your killer feature from Primary Care IT this year?
They've got a really nice tracker that works in terms of comparing your PCN-based income and that kind of stuff, which they've given to free. They've also got their one contact tool, which is really nice, full of loads of templates and stuff for practice working and that kind of similar to like I said, what the Ardens templates work, which probably a lot of people are more aware of and stuff. They've got a really nice integration with iAtro in terms of integrating that within your practice website, which is quite nice. So effectively, it brings online a different type of online consultation portal that works with the clinical systems as well. So I think they've just looked at this from the complete perspective, and it's a complete toolkit that does really do some cool things. But yeah. Ardens Primary Care IT are pretty much neck and neck at that. And like I said, if it wasn't just for the fact I think Primary Care IT have come from further behind, that's the reason why I'm eking it to them.
And Primary Care IT, they have the company that do practice websites as well, don't they? They're the same.
So no, they're not the same company.
Okay.
iAtro is separate. No, but they've got a massive association with. I think they collaborate very well with each other. It's basically the best way of describing it.
I was going to say, I was under the impression that they actually were co-owned.
No.
I'm sure you're right that they're not. But I thought I was going to say hats off for actually, integrating together different functions, for collecting different companies that do different functions together that complement one another. I really like it when companies do that. I think that's really smart. Maybe that's where they're heading, but at least it's a really good collaboration. So that's a top tech 2021. People may agree with this, they may not. They may wish to comment and suggest who they think are their most innovative companies, most disruptive elements or companies or organizations, and who they think are their top tech players for last year.
So that brings us on to next year. What is going to happen in 2022? So I love repeating this joke that 2022 is just 2022. Yeah. So hopefully it won't be as bad as what 2020 was in terms of COVID resurgence and that kind of stuff. But yeah, Andy, what's your prediction for the next year?
Moving into the third year of the pandemic, it's actually dragging on, isn't it? So 2021 has been a bit of a rough year for general practice, I think. There's been a lot of bashing of general practice in the media. Some of the way the media and the rhetoric's been controlled or played by the government, if you're being cynical, has been cynical. It's felt really tough. We've suffered in terms of lack of manpower. It's been hard to recruit, and we've often felt a little bit downbeat, I think, on the show. So for 2022, I am predicting a resurgence for general practice. Maybe this is more hope than than truly believing it'll happen. Although actually, I do believe that things can only be bad for so long. Reversion to the mean happens. That's the reason why when people leave it 2 weeks with their cough and then they come to the GP and they get antibiotics, they always feel better anyway. And some of them needed the antibiotics, but some of them it's just reversion to the mean. Their viral cough's just going and they're just going back to how they normally feel. So I think the pendulum must swing back the other way in favour of popularity of general practice as a career and in the general media. I think general practice has actually risen to many of the challenges of the coronavirus pandemic. Really stepped up in a big way with vaccinations throughout 2021 and definitely with the booster programs and providing lots of support with 6 short notice. General practice has been really innovative, using lots of these new technologies, bringing a lot of new appointment types online. I think all of this must eventually count. And I think also the value of general practice to the country and the NHS is really undeniable. And I think eventually the politicians realise this when they've been in the job long enough. I think Jeremy Hunt ultimately came to realise this, perhaps even after he left. He's been saying some sensible things about general practice, about the NHS.
Who would have thought that?
From his scrutiny committee seat. I think eventually people appreciate it. So, let's have a resurgence of general practice in 2022. Why not?
Okay, so Andy's predicting a new hope in terms of the return of general practice and the traditional, I guess in some ways, but the modern traditional general practice. By the sounds of it, yeah?
Yeah, resurgence, rebirth.
Okay.
Yeah, a renaissance, shall we say.
My prediction is going to be more, I think, the rise of Skywalker style, I'm afraid.
Okay.
So if you are to think of it, I guess the dark side is COVID and all the monitoring and all that kind of stuff, I think we're going to see the resurgence of actually private general practice in 2022. Now, whether that's going to be in terms of core practices being able to do more private work, possibly, because I know that the contract negotiation is ongoing at this point, and that's been a key stickler for many practices, the fact that they can't do certain things privately for their population that has an impact in terms of how they can see things and do things, or whether it is the rise of private companies being able to do more in general practice, because let's be honest, we have workforce shortages, we have a variety of other issues, and there's that huge backlog still to clear, which, for those patients that can pay, they probably will start paying for quicker access and that kind of stuff, which actually general practice just doesn't have the capacity to deal with because of the way it's funded and run and stuff. So I think we will see actually the rise of private general practice in the next year or so.
Wow, that's I was quite impressed by this prediction when we were sketching out this episode, actually, because I think there's something in that. The circumstances probably have created a market for private general practice that wasn't there in the same way before. So I can see people potentially paying for that. I know people from my personal life who have paid for private general practice consultations over the past year because they felt that they needed to get care. I do wonder, there could be a workforce tipping point. We've talked about this sort of potential tipping point between partnership, salaried and locum work, where the structure of that workforce market has incentivized certain behaviors in the general practice workforce that have led people to leave partnerships to become locums, that influence the choices made by young GPs to become locums rather than salaried GPs and partners. And just imagine if we're on the tip of another tipping point where actually people leave NHS funded primary care for, if not all, some of their time to do private general practice for another company or their own companies, in better conditions, better conditions, if not better pay, better conditions. It could happen.
It could happen. I wonder if some of that's going to be driven by patient demand. Let's be honest. There are different services now available compared to 15 years ago in terms of people being able to access private general practice. The rise of the remote companies that provide that has been significant over the past couple of years. So, timely access is a challenge, and the reality is that backlog is going to take a while for them to chip away at it. So until that happens, it's always going to be this kind of sword of Damocles, to use your previous phrase, and stuff. So we will see. But I think we're interested to know what you all think about our predictions, about our awards as well. Do you agree? Do you disagree? Do you think we've got it wildly off? I don't know. It'd be lovely to hear from you. I know we're going to keep doing this stuff, and we're going to be doing that in 2022, and we've got some awesome things hopefully coming for you again. So we've already mentioned the System 1 Facebook user group conference again. We have definitely got some more stuff with GP5T coming up in the new year, as well as potentially a few other conferences. The content's going to keep coming. Our live streams, we love doing those, and potentially some more collaborations as well, which are in the works. So hopefully you'll hear more about those in the next few weeks. Basically, we're just going to keep having a really good time talking about tech enhancing for your primary care and learning.
Yeah, let's bat on. Bring on 2022. Let's go.
Fingers crossed. All right, everyone. Catch you in the next episode. And as always, let us know what you think as we tech enhance your primary care and learning. Catch you later.
Goodbye.